You've been thinking about getting that perfectly aligned smile, but do you know what braces or aligners are doing secretly behind? No, probably not. You're not the only one. Are braces meant just to straighten teeth? Are aligners meant for you? During this process, what about the gum health? Watch this video fully as we unfold the real facts. Vanakkam. Hello everyone. I'm Dr. Aesha, oral and maxillofacial pathologist and founder of Squares Dentistry, Chennai.
So doctor, why do people need braces or aligners?
When you talk about braces, what comes up to your mind is those teenagers having the metallic smile. And when you talk about aligners, what comes to your mind is those social media influencers having invisible trays. Right, these kind of treatment can be used in the following condition. One could be crooked teeth, that is crowding, overlapping of teeth. The second could be because of the spacing between the teeth, that's the gaps present. In these two conditions can arise because of the discrepancies of the jaw size or teeth size. The third is the bite of the teeth. Normally when you bite, there should be a gap between 2 to 4 mm. But if there is any discrepancy, you could have deep bite or open bite. These conditions could lead to incompetent lips, that is, the lips are not approximated with each other, or there could be gummy smile. The next could be because of rotation of the teeth, or even it could be because of malaligned teeth. Malaligned teeth could be because of irregularly placed teeth. So these all discrepancies could lead to maintenance of oral hygiene becoming a challenge. So when you have to correct this, it's not only correction of aesthetics, but also the functionality is definitely corrected.
Okay, that's interesting. Too many reasons for braces and aligners. So can we talk about the difference between braces and aligners?
Definitely. So braces and aligners are used to correct these above mentioned treatments, right? So what is the final destination is correction of malalignment. For instance, if you have to travel or reach to the certain destination, you can use either a basic car or you can use a luxury car. Similar way, if you're using a braces, it is a fixed appliance where the orthodontist will place those either metal brackets or ceramic brackets over the tooth structure, along with which you have wires and elastics which are placed. So this treatment requires every month follow-up at the clinic. That is the most important thing. The other advantage about braces is it is completely monitored by the orthodontist. Now, which treatment is better for you? Definitely the orthodontist will take a call. Which option would be faster? So braces has a controlled, programmed effect. Movement of the tooth is given. So at every visit, the orthodontist decides what kind of elastic strength should be given or which kind of wire should be placed. Accordingly, the tooth movement is structured. Treatment duration is also taken care accordingly. When it comes to aligners, these are removable appliances which can be worn at any point of time. The most mandatory thing about aligners is the discipline. You have to use the aligners for a minimum of 20 hours a day. So you have 4 hours gap. That 4 hours gap is for eating or drinking water, or if you have any occasion where you need to remove the aligner and go ahead. So in those kind of options, you use aligners. So aligners, how does this work? When you come for the treatment, we first start with scanning. Based on each individual patient, it is tailored as to number of sets given. So if you have mild movement that needs to be done, the number of aligners are reduced. In case you have a complex alignment that needs to be done, the sets of aligners are more. So every 10 to 15 days, each set of aligners have to be changed. Now all these will be monitored and taken care by yourselves. That is definitely an advantage in one way, but on hindsight, if you see, it is again monitored by yourself. If in case it's a complex, the orthodontist will advise a second set of scanning in the mid of procedure to see if the movement is happening correctly, and if we need to add on further sets of aligners, that could also be added. So in a nutshell, if you see, braces are fixed and effective. Aligners are definitely lifestyle friendly.
Now we often forget about gum health. So how important is gum health during this journey?
A tooth is placed in the bone and surrounded by gums. During orthodontic treatment, either in braces or aligners, the tooth is moving. Along with that, there is changes in the gum tissue. If you don't maintain proper oral hygiene, it will definitely affect your gums, which can lead to inflammation or swelling of gums called gingivitis. This will need periodontal intervention. So this could lead to either lapse in the treatment or it could be delay in the treatment. So gum health is definitely important during orthodontic procedure. If orthodontic treatment is done without proper gum care, it's like building a house on a sand without strong foundation. Healthy gums leads to successful orthodontic treatment.
What's your advice for anyone considering braces or aligners?
Braces and aligners are good for any age group as long as you have a good gum health. Once you book your appointment with the orthodontist, they will evaluate and give you various treatment options and scanning procedure is done, further which you can consider according to the treatment plan. If you're ready for the first step to get your perfectly aligned smile, we at Squares Dentistry would love to have you. We are open 365 days a year because your smile deserves our support every day. Next episode, we invite our gum specialist to give a detailed insight about gum health.